Hey guys, it's Caitlin. Welcome back to my channel. Today is a new day full of new blessings. My little blessing of the day so far is that I felt well enough to make it to the grocery store for a quick trip of essential items. So I decided that I wanted to talk about the POTS treatments I have done over the past 3 years. I've tried anywhere from medication to natural remedies to chiropractic work to biofeedback. I have tried a big variety of things, so I wanted to talk about everything, but I figured doing everything in one video was going to be very long and people wouldn't really be interested in watching it. So I'm breaking it up into 3 videos, which consist of Western medicine such as medication and IV saline. The second video will be alternative medicine like natural supplements or other natural products that aren't medication. And then the third video is going to be like the other categories such as physical therapy, biofeedback, and compression. So yes, this video is going to be talking about Western medicine. So let's go ahead and get started. So I am hypersensitive to medication and their side effects, so I'm not usually a big proponent of trying new medication, but when you have a chronic illness and nothing else is working, you at least want to try it to rule it out, and that's exactly what I do. I have only tried 4 medications specifically for POTS, and then I've also done IV saline. So we're going to go ahead and get started. The first medication I will discuss is Midodrine. This is a very common medication for POTS. Almost everybody who I have talked to with POTS has either heard of Midodrine at least or has been on it. But it works to raise your blood pressure to improve your circulation. It's usually one of the first medications that a POTS doctor will put their patient on. At least that's what I've seen from my experience. So I was prescribed it 4 times a day, and I was on that for 6 months. It worked pretty well for the first couple of months. I felt like I could be more upright during the day. I don't think I necessarily had more energy, but I could tolerate being vertical longer in the day. But then as the months went by, it kind of like faded off, and we played around with the dosage a little bit, but that wasn't making any difference. So we decided to go off of it. The only side effect I had, which is very impressive for me, the only side effect I had was tingling of the scalp, and that is a very, very, very common side effect. Almost everyone I have talked to who has taken Midodrine has said they also have the tingly scalp. So, but it's definitely manageable and tolerable. That's not a reason that I wouldn't take the medication. The second medication that I tried is called Desmopressin. I haven't heard of this medication in the chronic illness community too much as opposed to Midodrine, but it works to help you retain fluids. I don't really retain my fluids if I drink something, especially like tea or soda. It just runs straight through me. So the more I drink, the more times I'm going to the bathroom. So we tried Desmopressin to try and retain my fluids, to absorb the fluids better and get more benefit from actually drinking, but it didn't really work for me. It didn't really change the way I felt. This is also a common medication that doctors will put like kids on if they have trouble holding their bladder for the entire night. Obviously that's not why I was put on it, but it essentially works the same way. I think I was on it for maybe 2 or 3 months, but from the very beginning I didn't really feel any different. The third medication I was put on is also another common POTS treatment, and it is called Florinef, which is also known as fludrocortisone, and this is a type of steroid, and it helps increase the blood volume and blood pressure, and helps also maintain the salt in the water in your body, which are 2 very important things for POTS. I was on it for less than a month. I couldn't even wait it out because the side effects it caused me were so severe. For me, it caused me intense migraines and intense dizziness. For other people, I've heard they gain weight, and I can't really think of other side effects that I've seen other people have. But again, everybody's different. You won't necessarily have my same side effects. You likely won't have my same side effects if you went on the medication, because I have unique and unexplainable side effects sometimes. But yeah, so I couldn't even wait out the bad side effects because it was just so miserable. And it didn't improve my symptoms either, so there was no point in being on it for me. However, I have seen that people feel more energetic and more human when they are taking or when they took the medication. So that is a possible benefit for you. And the fourth medication that I tried is called Metoprolol. It is a type of beta blocker, and beta blockers are also another common treatment for POTS. So I, as I said, I took Metoprolol, but there are also propranolol, and there are a bunch of other beta blockers. And then there's also a medication called ivabradine, which I've never tried, but I've heard that is even better than a beta blocker. But just some information. But I tried Metoprolol. I was on it for about 4 months. It works to improve blood flow and lower your blood pressure. And I was on it for about 4 months. I didn't feel any side effects, but I also didn't feel any benefit at all. So I decided to taper off of it and not take it anymore. Because again, there's no point in being on a medication if it doesn't do anything for you or it makes you miserable. So that's just my philosophy. Some people deal with the side effects in order to get the relief. That's not me. So yeah, so that is all the medications I have tried for specifically POTS. So now I am talking about IV saline. I'm pretty sure everybody knows what IV saline is, but if you don't, it is a sodium chloride and water solution, so salt and water, which again are the two, some of the two most important things for POTS. If you've ever been to the ER or had an operation or procedure that requires general anesthesia, you have likely had saline before. But this is very, very, very controversial among healthcare professionals and among patients as well. One side of the argument is that you don't want to become dependent on saline, because then when you take it away, your body doesn't know how to function, and it is not a good permanent solution. And I kind of see that as like, you could say the same thing with medication too. Like your body, if you take a medication and it helps you, then that's your body depending on the medication to keep you functioning during the day. So I don't really see the difference in that aspect. But another aspect that makes it controversial is that it leads to a greater, very, very greater risk of infection. In order to get IV saline, you have to have some sort of foreign object in your body, whether that be a regular IV or a PICC line or a port or a central line. And anytime there's a foreign object introduced to your body, there's a bigger risk of infection. Even like getting a blood draw, there's risk of infection. So that's another part of the controversy, is that doing IVs for a long period of time or having a PICC or port for a long period of time can lead to dangerous and scary things. But for some people, the possible benefit of the saline just outweighs the risk of those, because they're so desperate to try things. And I feel that way. But I tried saline, and this was the treatment I was most hopeful for, because I have heard nothing but great things about saline for POTS. And it, of course, did not work for me. Story of my life. I later did find some other people in the chronic illness community who also did not benefit from saline, so it was nice to see that I wasn't alone, because I thought that like everybody benefited from saline. I didn't know it was possible to not benefit from saline. But for the patients that have tried it and it works for them, they see amazing benefits. They can continue in their school, they can go to work, or even simply they can be upright during the day. Some POTS patients have to be bedbound because they're so fatigued, and that helps them at least get out of bed and walk down the stairs in the morning. And if that's what works for you, then that's amazing. So you do what works for you. So that is the end of my Western medicine POTS treatment video. I've tried way more alternative medicine things than Western medicine, so that video is going to be a little bit longer. But you can look for that either in the next couple days or next week. But I'm really excited to make that video. But yeah, thanks for watching. I really hope this helped you in some way, whether that be better understanding the medications you're already on or helping you find suggestions to show your POTS doctor about what might work for you. I think I worded that really weird, but you know what I mean, so just go with it. But yeah, thanks for watching, and I will see you guys next time. Bye!